Hello, so today in this video I'm going to be talking about the clinical reasoning behind why I made a decision in my most current placement. So the decision that I'm going to be talking about is why I did ADL retraining with one of my clients. So the client that I'll be talking about, she has had a right MCA infarct, which has resulted in her having dyspraxia, mostly ideational, however she had some ideomotor, expressive and receptive aphasia, and a decrease in mobility. So based around the POP and the reasoning of my intervention of ADL retraining, this client, she had decreased performance within self-care, and prior to her stroke she was very independent, and now she's very independent and requires a lot of assistance within the shower. She requires assistance in dressing, showering, drying and grooming, and also within her mobility. And that performance has decreased a lot. Therefore, due to this and using my narrative reasoning, I realised that this could potentially be a very important goal for her, and I selected that. However, I also had ethical reasoning there and realised that I've selected this goal, therefore this mightn't be important to her anymore, and if so, I have to respect that. However, every time I went in to do a treatment session with her and have a shower, she was very welcoming to me and she was always keen to have a shower. So within that area of the goal setting and doing that intervention, it was very fine. Based around the environment, I had a bit of scientific reasoning here because evidence states that to have effective treatment with a dyspraxic person, you have to have the same environment every time you do a session. So I was quite fortunate that my client had she had an individual room, so she had her own bathroom. So therefore we were in the same environment every single morning, and she then eventually came familiar with it, and we also had the same equipment. So that benefited our therapy a lot there. Based around the person, so as I stated before, she was independent. However, spiritually, she was a very proud and independent woman, and she valued her independence a lot. So again, I used my narrative reasoning there and said that as she's very dependent now in something that she used to be very independent in, I thought she would value this goal a lot and would really achieve it and be motivated to do it. And she was, as she further down the track with the therapy, and when she became more expressive, she actually stated that this is a goal that's important to her. So that was kind of my reasoning behind that, using the POP. However, additional reasoning was for selecting ADL retraining was a lot of scientific reasoning, and within stroke and having a dyspraxic person, beneficial treatment for this is, and good therapy is, to do the same thing every single session and getting them used to it, and eventually over time they will have a bit of understanding and initiate a few tasks. And within the shower as well, it's also, you can get a bit of automatic movements going as well. So for her, for example, our daily session that I did every single day was, we would sit down, get undressed, wet herself, wash herself, dry herself, and then get dressed. But even dressing was very structured, and she had to pull her underwear on, then her pants, and then her shirt. Also, I had to be sure and be very careful that my commands were the same every single time, because doing that, and scientific reasoning and evidence states that having the same consistent commands and sequencing works for the treatment around a person with dyspraxia. Overall, that's kind of my reasoning as to why I did ADL retraining with her, and over time I graded it so that it was still a challenge for her when it got a bit harder for her, and now she is actually independent within the shower. However, it requires supervision because of her safety still. So yeah, that's my reasoning behind doing ADL retraining with that client. Thank you.